Doctor, when and how this obsession and compulsion develops?
Number one, it starts around the age of 10, 12. Very, very early age. And I told that it's going to be there for a long time. So it's almost starting from the age of 10, 15, it goes on. Every OCD, does it go on for? No. There are some patients where the OCD is for a shorter period, which we call as sort of episodic maybe. It comes for some time. Then fortunately with the medication treatment it disappears and then completely stops, and then later after some time it may have. There are some people like that. It happens both boys and girls, it's almost the same, not much of a difference. And hereditary, I think, see, like we have to understand medicine, everything is hereditary. Starting from diabetes to heart attack to cancer to everything is hereditary, but exactly it's not. It's not that if your father, that's one. If your father has OCD, doesn't mean that son has to have a OCD or something like that, but the chances will be high. The heritability is more than 50%. So if there is in the family, but doesn't mean that they're going to have it, definitely. Now if we can go into the little bit of the symptoms of the OCD, as I told you, first let us look at the most common thing is contamination, washing rituals. It's a kind of ritual. When do you call something a ritual? Because it happens again. The simple example, again I go back to that. My hands are dirty. My hands are not clean. So what happens if my hands are not clean? When my hands are not clean, I do something. I serve my children. I do something in the house. Whatever this thing, like it's dirty, that gets passed on to the food, that gets passed on to the other things. So the whole thing becomes dirty, and my children get sick, my family members get sick. So I have to clean it. Is there anything wrong in that? Washing hands, is there anything wrong in that? Absolutely nothing. We all do that. We all do that. Actually, sometimes, like some of the patients ask me also. When I ask them, what is this? How long do you? Doctor, don't you wash hands? What's the problem? Everybody washes hands. But the difference is, you and me wash hands once or at the most second time. If it is very dirty, third time. But here, you may not believe it. Sometimes they wash hundreds of times. There's a peculiarity. One of the patients told me, Doctor, it started with I have to wash my hands 3 times. Then after a month or 2 months or 3 months, it has become I have to wash it 3 into 3, 9. Then it becomes 9 into 3, 27. Then it becomes 27 into 3, and it goes on the multiples of it and the umpteen number of times. And then the sad part of it is, they have to count. 1, 2, 3, 4, 5, 6, 7, 8, 9. In this process of 9, 10 and all, suppose somebody likes you and comes in, hello Dr. Reddy, how are you? That the count is broken. Oh God, I have to start it again. So you imagine him, suppose, I know that I don't have to, but I can't help it. If I stop instead of doing that 27 at 20, something will happen to my family. Somebody is going to die. Somebody is going to have the problem. That is the kind of a thing which comes. At this point, let's discuss about something interesting. I said 3. So repetitive, intrusive, which patient knows that he should not be, but he cannot stop it.
Doctor, why the repetition of 3 times? Why can't it is 2 or 4 or is there any specific reason behind that?
Why this 3 comes? Let's look at it, because some of these obsession compulsions are little bit extension of what we do in the day-to-day routine activities. No. See, 3 I told, only some people have that. It's not that everybody does it in 3 and multiples of this like that, but that's one of the common numbers. At least a few patients who talk about, they talk in terms of 3. Nobody has talked to me in terms of 2 and multiples. There may be. I think I was talking about some of these OCD symptoms are a kind of an exaggeration of what we do in normal life. We do check the door once, they do 100 times. We do wash the hands 2 times, they do 200 times. It's only the difference. 3, Point is, what I was trying to say is that I was talking to you about just washing hands. I'll tell you one or two other things. Quite a lot of times, women, the reason for washing and then not touching is whether this particular object here, this cloth here, has got any stains of menstrual fluid. I had a patient who had this obsession about any part of this cloth, is there any touch with menstrual fluid? If it is touched with menstrual fluid, it is not. You remember now, like in good old days, when people, now like when women have the periods, they are asked to go and sit outside the house.
Yes.
And then like even one of the even third part of it is, somebody who has got the menstrual periods, those 4 days you wash. It's not a problem here. The problem with this lady is, she has got this obsession that whether this particular cloth is contaminated with the menstrual fluid, right? I sit in my house, guests come to my house, a lady comes, she sits on the sofa, she sits on the bed, sits on somewhere. There's a doubt for this lady whether this lady is in the menstrual period. If she is in the menstrual periods, if she is having the menstrual fluid, a drop of it, something would have touched the sofa or this. So the moment they leave, they'll start washing the sofas, washing the clothes and all things, which is not like just relatives cannot understand. They clean it. The same thing happens. Why I'm saying is that some of the rituals which we normal so-called people do, suppose you and me go to, somebody died in the family and then you go there to attend that. You go to the graveyard sometimes with them. When you come back, we are all supposed to go and take bath. So repetitive, intrusive, which patient knows that he should not be, but he cannot stop it. Right? If there is a patient with OCD, that she will not even let you enter the house. Even before entering the house, all the clothes are to be removed, packed in a separate way, put it separate so that they will not touch the other thing. Wash the feet before. A lot of times this becomes a problem. When children come, small children, when they come from outside, mother insists that you have to wash the feet before you enter the house. Husband has to remove the shoes and wash the feet outside. Before, by chance, by mistake, if they enter the house without washing, it's finished. She has to wash the entire floor. Now you get the point. What we all do it in a limited sense, this gets exaggerated hundreds and thousands of times and it gets into a disease part of it.
Thank you, Mr. Reddy.
Thanks, Sandy. It's so nice.
Time.
Thank you so much. Thanks. It's a good time.
Hi friends, please give your valuable feedback and comments on our program Shades of Moods.